So Amit, can I just ask you, I know I'm going slightly out of order here, but actually there was a question that came up about why so many people, well, so many consultations are happening. Is there have you got any suggestions as to why that's going on?
I think the reason for that is the presentations are often quite vague. When you look at 100 patients that are referred to a particular hospital with acute leukemia as a final diagnosis, actually the presentations are very diverse, and there aren't really very many distinctive specific symptoms or indeed red flag symptoms that you can have for other types of cancers. And so clinically speaking, actually, you're in a very difficult position because there is nothing that stands out, and it's vague and overlapping with other much more common problems. And so it's very difficult to gain experience with such a low caseload of leukemia patients. And when you combine that with the vague symptoms you have, it makes it very difficult,
So actually,
to
you'd
think of
almost
leukemia.
yes, you'd almost expect that they would have had quite a few consultations because it's the persistence of the vague symptoms that's concerning rather than the vague symptoms themselves in the first place.
Exactly. It's the non-resolution. But
Yeah.
I would, one thing I would say is that whatever the presentation, really the blood count is the thing that will help you to try and make a diagnosis early. The symptoms really are not going to be very helpful. They should really be used as a way of doing a blood test.